Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gawain Vaughn.
And it's time for a show. The Auburn Medical Group comes to you, brought to you by Lindsay and Twain and some other people. And,
hi, Linz.
And oh yes, Mr. Ed is back.
Hey, we've got somebody here.
Check him out, Mr. Ed.
There he is.
Hey, hey, hey.
Thank you, Mr. Ed, for joining us. And this is a special show. We thought you may have seen the trailer. I think anybody that's seen us saw the trailer. Is that how it works? Unless they came in late.
I don't know.
So if you saw the trailer, you saw that today's show has something to do with Mr. Ed.
Something.
And we changed the title from Stitches to Mr. Ed's Cortisone Shot. So, Mr. Ed, what is it we're going to do today?
I don't know. I came in here. I've been gone fighting fires all week. And I come in here and you want to dig on me. I'm not sure
dig
what.
On you.
No,
I dig, Mr. Ed.
I know. You guys know I got a little arthritis in the knee or on the knee. What do you call it? And you're going to...
We call it the knee.
You're going... No, wait a minute. Isn't it called a patella or something like that?
That's
joint.
a bone on top of it. But
okay.
That's not what the arthritis is.
What do we call that joint?
And so tell us, what is arthritis anyway?
Okay. Well, we should talk about arthritis here before we get going. Arthritis is inflammation of bone, and oftentimes comes from a narrowing of two bones that are... See, bones don't actually touch each other at joints. We have so many joints throughout our skeleton. And the bones that seem to be coming together aren't actually touching. There's a space between them that's cushioned by fluid. And usually there's a little bit of cartilage on the surface of the bone there. And with arthritis, we get inflammation there so that there's a bunch of chemicals that cause destruction and abnormal bone growth and decreased space between the bones because the cartilage is getting thinner and thinner.
Right.
There's different types of arthritis. There's inflammatory and non-inflammatory arthritides, and there's also several different ones of each of those. The most common that we're working with when we're working with knees is just plain old run-of-the-mill osteoarthritis. Degenerative joint disease. We sometimes call it wear and tear arthritis, although if that was the case, it would be worse in people who have more wear on them, and that's not the case. Some people just have bad arthritis regardless of how active they are. So,
Right. That being said, the most common places are still in the hips, knees, and thumbs. Places where, hips and knees where we're always moving, always walking, always putting weight on. Those who are overweight have a slightly higher risk of that.
a lot higher
Yeah,
risk.
we have these cool opposable thumbs. So at the base of the thumb, we get those who do a lot of articular tasks and just normal.
It's not a design that nature has had as long as some of the other joints and parts of the body, so it's subject to arthritis.
We use it, yeah.
Kind of like the low back is subject to a lot of arthritis that we see in our practice. Again, a newer feature in biological organisms.
Yes.
Not quite perfected yet. It's too new. We're all beta.
Beta.
For opposable thumbs and walking upright.
Learning how to use that.
Yeah, upright bipedal ambulation. Yeah.
Right.
Well, I understand it's not just guys like me that have pain in the knee from old age. A lot of athletes.
Oh, absolutely.
And the shoulders, they have to be quite actively replacing shoulders lately.
Yeah, so when you play sports, often you have injuries associated with those. So anytime you injure a joint, it makes you more likely to have arthritis in the future.
Yeah.
So knees, common place for that in people who play sports that are hard on the knees. Shoulders are very common too. And we replace shoulders now. Well, not we specifically, but orthopedists do. They'll replace shoulders. And that is the kind of end stage treatment when it gets so bad that the injections aren't working. That pills aren't even working, the anti-inflammatories, they move on to actually replace that joint. And we can do that with the big joints, the shoulders, the knees, the hips. However, when we get into some of the smaller joints
have some
in the fingers, it's not
those
as
silicone things they put.
Yeah, it's usually a fusion though. That's usually what they'll do if they're gonna.
This would be a good show for a family member of yours who has arthritis and is considering
Considering it, yeah.
Maybe she should be watching this show.
How does that differ from tennis elbow?
Oh, great question.
Okay, so
that's outside of the joint, first of all.
Okay.
not an arthritis, a tendinitis.
Yeah.
Soft tissue inflamed instead of bone. Yes.
Yeah.
Oh, hey, we
Well,
have comments.
we scared off Margaret Campbell. I don't know what we said to shake her up, but here's Mari Gracia. Mr. Ed used to be a famous horse. Mr.
What?
Wilbur. Okay.
Wilbur. We know what you're talking about.
There they are, my favorite and splendid father and son team. Oh, well.
Yep.
Okay, Mary Gracia.
Every time.
She does that to
We
me.
appreciate your comment.
Every time she does that to me.
Every time.
Okay. All right. So with that,
Oh, wait, but one more question. What is surfer's knee?
Surfer's knee. I
I
don't
know
know if I've heard that
you
one.
you have kids.
It's probably a bursitis.
They
That's
get
what I would
knobs.
imagine.
They get knobs on their knee, right below the kneecap.
Oh, you're talking about Osgood Schlatter?
Okay.
that's not unique to surfers, though.
No,
that's like basketball players doing the jumps for the
Yeah.
rebounds and
When
whatever.
you're growing,
Yeah.
kind of an overgrowth of the
surfer's knees.
Ask your son.
I would
I
He'll
know
know.
about surfer's ear.
Yeah,
Oh,
yeah.
I've heard
Cold
of
water
that too.
nodules. You probably have cold water nodules, I'd guess, if we looked in there.
Oh my goodness, do we?
Probably.
You can operate on that next.
Hey, we'll look at that next show. Something to look forward to.
My goodness.
Okay, well let's get back down
suspicion
to.
in his eyes. Did you see that?
What are you gonna do to my ears?
So,
Well, if we're gonna do the procedure, let's
you ready?
let's get right down to the rat killing. Okay.
let's get started here.
All right,
so
how are we gonna do this?
I'm going to come over to Mr. Ed, and we're going to share his mic. Oh, I'm going to wear my mask because I'm supposed to wear a mask when I'm doing doctor stuff in a room with a
I guess
patient.
that means I'm doing video. So we're using this one.
That's the one that's catching what's going on here.
All right. Okay.
I can adjust it to Mr. Ed. Which knee? See, notice how
Left knee.
left knee. Boy, we don't have a lot of light down there. Let me see if I can. Ah, look at
Look
that.
at that.
It's like you.
All right. So I'm going to tilt this down toward the
There we
knee.
go. Good thing you wore shorts. It's
Should
like
I
you're
stand up?
No, we're
like
going to have
he
you
was-
seated.
prepared.
What do you think? I think we should just have his knee just like that, 90-degree angle.
Yeah,
work.
like
Yeah,
that.
yeah.
Good looking pair of legs there.
Yeah, look at that, man.
You must work out.
He must forget. So I think
I
that
think that'll work. Maybe you just move it over that way just a little.
his knee or the camera.
No, hit his knee.
Yeah,
yeah,
there you go. Yeah,
over to the-
there you go.
Right there.
Right about here. And
That'll
okay,
work.
I'm moving Mr. Ed's mic. I don't know if it's
Covering
making a
up
bunch
your-
of
your
noise.
Shading the area.
I know, I'm shading.
Well, you don't have to hear me when I scream.
Spent like a half hour on the shading of the upper lip. Okay, so this is the knee. And let's see here. So I wonder if the fewer comments than typical is because I changed the title of the show
Right at the
a
end.
couple minutes before we went live.
Switched it.
Okay, there we go. So this. We refer to this part of the body as the knee.
Oh,
Okay.
enlightening.
Mr. Ed wanted us to clarify that earlier. So right now, I'm touching with my fingers. I'm not doing anything painful. I don't think.
Ouch! Ah!
So, he was asking about the kneecap being called the patella. We do use that as a landmark to find where we're going. And I'm finding this tendon that connects the patella to the tibia here. There's a little tendon there.
Almost going off
In,
the video.
in the, oh yeah, can you help us with that? There you go. Well, here you have to loosen it, but it doesn't go down any further than that. So
it will if I turn it. Turn it to the side. Where?
well, you have to loosen it if you want to turn it.
Oh, yeah, down to that. There you
Okay,
go. Now
there.
it'll go down a little better.
Is that it?
Yeah.
Here, I tightened it.
Just a little
This is the spot.
There.
You know, I can just put that right here
could work.
and aim it up at it.
Is your no? You don't. Your course.
Oh no, yeah, that's right. It's not long enough. Okay, thank you for noticing that. How's that?
That's good. That's perfect.
So the tendon, go medial to the tendon, medial meaning toward the midline of the body. And under the patella, And then we're going to be aiming upward a little bit at that angle. How's that look to you, Dr. Gawain?
I think that looks pretty good.
Okay, so.
You maybe want to go a little more angle up in my
A little more upward.
In my opinion.
Getting this ready.
Ooh,
I should
you can
have
see
my...
it right there in the video. And a Sharps.
Sharps container is...
That's where the lower part of the leg goes after we're done.
Okay. They can't see this, but yeah, squirt a bunch of that on there.
All right, Gracia wants to know, where is everyone today?
Where is everyone?
Am I in the right show, she asks.
And I'll put them here when I'm done with them. So right now I am preparing the materials for the so-called prep, meaning cleaning or disinfecting the area where we're working. We start from the middle and we work outward. This is not the brown stuff that we used to use when I was in training for stuff like this, the betadine.
No, the purpose of
this is prettier.
The purpose of the shot is to take the pain away for a while, or?
Yeah, talk about that, Dr. Gawain, while I...
Sure. So there are two medications in this injection, both a numbing medication and a steroid-based medication. Yeah, and that's the cortisone is the term that people often use. Cortisone is one of the older steroids. We use a newer one called methylprednisolone, mostly because...
Actually, this is triamcinolone.
Or triamcinolone. That's a newer one, too. So the numbing medication works instantly. Yeah, you're right there. You're right in the frame.
Really.
So it works instantly, and you get numbing for typically 6 hours or so. And then...
Some wise guy here saying, don't jump, Mr. Ed.
Don't jump. Yeah, typically I brace the knee so people don't kick me after when I'm doing this procedure.
Yeah, we don't usually do it in a chair.
Yeah, exactly. But anyways, the triamcinolone is a steroid. A steroid is a potent anti-inflammatory. I got to come over here.
Yeah, you're going to yell.
And spray.
You know the spot.
Yep.
Thank you, Dr. Gawain.
That's a cold spray we're spraying on there. Wow. I want to make sure that I'm not...
That is cold.
Not covering up the video.
A little bit higher.
Oh, where are we? I can't.
There you go.
There we go. Sorry, I couldn't see.
A little bit to the right. You're right.
Am I right?
There you go. That's
You're
fine.
Right.
That's fine.
You're right. Am I right? That was cold. So that was just a topical numbing spray that we just sprayed on there. So there he goes. Place the needle in, go right behind the patella, and put in the medication.
Is it showing up?
Yeah, you can see it.
Those are good.
It goes in really easily.
Yeah, that's how you
in the
know
right
you're
spot.
in the joint. If you're in something and it's not moving, you're in the wrong place. You got to back out and There it is. That's it.
I don't need stitches.
Well, that's what I'm just now remembering is I didn't bring a Band-Aid
that's what we forgot.
into the studio.
Well, hold on to it.
Well, that's what we forgot.
Somebody bring it. If somebody's watching just
Works
outside
in this office.
of the office,
Want me to hold?
a Band-Aid would be very helpful.
You're mopping up an awful lot of blood there, Doc.
Oh, man.
Okay, something that I will normally do after doing the procedure like this. Let me put this stuff in a place where it's
Clean up after yourself there.
okay. Yeah,
It'll be all right.
I'll twist the ends.
All right. Now, should we put this
the
back
ends in
up
my
to
trash.
see our
Then I'll put it
patient's
in a
facial
a red
expression?
bag. Yeah, get his facial expression, but also what do I typically do after? I have the patient walk around on it.
Yeah, I'll
to
usually
demonstrate.
kind of milk the knee, kind of pull it up and down.
Mr. Ed, can we actually have you?
That knee is dead right now.
Yeah, you're right. So that's that numbing medication working. We gotta see you walk around. But
Yeah,
first,
walk
I want to
around.
say thank you, Laura. Oh,
Yeah.
watching him.
Thank you.
She says, I feel your pain, Mr. Ed. I get gel injections in both of my knees every 6 months.
That's next, I suppose.
You definitely
No,
need
one or the other.
She says you need the Dutch Brothers after
You want me
this.
to keep walking? Or
That's probably enough to get it. So the reason we have you walk around is as you kind of move that, flex that joint, you start to move that around within that joint space. So that's why we're doing that.
So who was that?
Laura Barzyk.
Laura
Thank you
Barzyk.
for joining us.
Laura
I haven't
Barzyk.
talked to her for a while.
I'll make sure.
Hi, Laura. Is that $50?
Yeah.
Oh my goodness.
But let's talk a little bit about the gel injections that she gets versus these. So this is different. This is a steroid injection. A steroid injection.
I'm back.
You're back. We're back. It's like nothing ever happened. So
that's easy for you
steroid
to say.
injections like these, we can give about every 4 months. And that's just because we don't want to give too much steroid too close together. It actually can be.
I'm sorry. Did you say 4 months?
Yeah.
Oh, yeah. That's why I do 4 months.
Yeah. So we don't give it too close together because too much steroid in a joint can actually weaken some of the structures in there.
Yeah.
So we don't give it too often. And we don't give it too many times. There is a limit to how many times we'll give it. Now, that being said, orthopedists will often just keep going. They always have surgery in their back pocket that they can always do on a knee that we don't. So as primary care physicians, we have a limit to how many. But that's a steroid injection. A gel injection is actually different. What it does is it is the synovial fluid. That's what I'm looking for. That we inject in there. We don't do that as primary care physicians. That's done by an orthopedist. It's a series of injections, usually 3 at a time, separated by a week. And the idea is that we're getting in more of that synovial fluid to create a little more cushion. And it can last longer often. So it's a little different. There's no steroid in that at all. It's made from a rooster comb, actually. You know roosters? They're comb.
Hyaluronic acid, which is what is normally the fluid in a joint. So I always wonder, isn't it already there?
Yeah, they're putting more in there, I guess. So the idea is that we're creating more of a cushion.
You say a gel. Does it expand after it's in the knee?
No, but it is thicker. So what this was kind of watery.
Yes.
It's literally a gel. So because of that, they actually need to use bigger needles to get it in the knee. So we feel you, Laura. Those are.
And Laura has another comment there.
Painful.
Steroids raise my blood sugar over 300 every time, so I can't get them. My orthopedist uses.
Wow.
Just one injection. Okay, that makes sense.
Oh yeah, you should know that this could raise your blood sugar. Yeah, Mr. Ed.
After this,
as can the Dutch brothers.
As can Dutch brothers.
Yes.
Oh boy.
They work in conjunction. Yes, that's how
they
it works.
work in conjunction.
So you did a great job explaining it while I was doing the shots, and we got the shot done. And Mr. Ed walked. I need to know, Mr. Ed, when you were walking around there, could you tell that there was less pain than before we did the shot?
Well, my knee was numb. I guess it's supposed to be that way. Yes.
So you couldn't feel it. You couldn't feel the pain that you
couldn't
normally
feel anything. Yeah.
Yeah. So that's a diagnostic.
Yeah.
Part of the procedure anyway. So this injection can be both therapeutic and diagnostic. Therapeutic meaning we're treating something. Diagnostic meaning we are actually diagnosing something with that.
Will I be able to drive home? This is my clutch leg.
Can you tell what you're doing with your foot?
Still
Yes,
fine.
yeah.
Okay, all right.
Your functions then should still be fine.
Good question, though. All right, so going back to the comments here, we have, it's just Rusty saying hi.
Just Rusty. Hey, Rusty, I think you're more than just Rusty.
There you go.
He's right. You're more than just Rusty. You're also part
Rusty
of the
B.
Rusty B.
You're Rusty. Okay. All right. So that was a good knee injection. Thank you, Mr. Ed, for sharing
that
with
went in
our
nicely.
viewers.
I mean,
we really appreciate you doing that.
That looks like a nice smooth.
Now Rusty comes back with saying he's old Rusty. Oh, my.
Oh, nice.
All right.
Rusty.
All right.
So I feel safe. I feel like I'm going to be able to get home.
Oh, good.
Without incident, yeah.
Good. And you did rescue the animals last week, so we appreciate that. And everybody thought you were a hero for doing that.
Well,
you were moving them from Grass Valley to...
You know, people think if you save horses and if you save cattle, you're a hero. But if you're saving chickens and geese and pigs and rabbits, you're just...
I mean, what are you doing? You're saving
just a mess.
Bacon, chicken, eggs. I mean, there are some good food groups there that you're saving.
And then you have to find places to put them. It wasn't always prepared. I remember taking to El Dorado, Nevada County, or different fairgrounds.
Yeah.
Well, we appreciate you doing it.
Yes.
So,
and we did get some rain, so that was good too.
We almost spoke...
Don't you guys miss the smoke?
For those of you who don't live in our area, the rain has come and completely taken out the smoke, and I'm guessing it's helping with the fire.
I would hope so. I actually have not heard anything, so
I
that's a
haven't
good thing.
I haven't
would
heard about any
imagine.
lightning, and
Right, yeah, that's the one thing to worry about with. But
yeah, we changed the title of this show just minutes before starting so that we could do Mr. Ed's knee injection, and he was so nice to give us permission. He didn't know that I already made the trailer, counting on him letting us do that.
Right.
And the show was going to be about stitches.
Stitches?
Because of your Dr. Green Knight blog
My
post,
post,
which
yeah.
we still have the link in the.
Oh, okay,
I left
yeah.
it in there.
Yeah, go check
I did
that out.
take it out.
Go learn about some stitches.
What did
Actually,
you-
it's a story about stitches in my family.
Yeah, what'd your little guy do?
A youth group. So
That's what he did.
that's what he did.
The youth beat him up or what? I mean,
Oh my goodness. No, he was doing some chasing game and ran into a table.
ooh, ouch, okay.
As can happen.
Yeah, I got a
We
little-
get to hear about this and the
Yeah.
stitches next week, right?
Oh,
we could talk about it.
we kind of just.
Or you
did.
could just go over in
Follow
that
the
blog
link
post.
and-
Yeah.
And when they follow that link, they can also follow it on through to.
Yeah, because not only did my son get stitches, about a month, maybe it's probably been a couple months now, huh? I needed stitches in my finger. Oh, it was before we traveled, I believe. So
Yeah,
it's
I
been a
think so.
while. It's
Yeah.
been a while then, like 3 months. And
It was another after-hours stitches encounter at the Auburn Medical Group.
that's usually how they happen.
With the
Me
two of us.
calling up somebody.
But it's a video of that one, so you can watch that. And then, but what I meant though is they can follow through to your Patreon,
Absolutely.
like
Yes, yeah. So there, I do have some Patreons over there that I'd like to thank. Teresia Rowatt and Lindsay Antoine.
Sir
Thanks for
Lindsay.
Sir Lindsay. See, you got it down.
and also the Patreon for this program and for the videos that I make is patreon.com/Dr. Vaughn, and that we also have Lindsay Antoine to thank. As you can see, very shortly you'll see it over here in the video, her name along with some other people's names. And it looks like Mr. Ed just noticed some kind of a comment coming through, so we'll put that
What's
up here.
your comment?
What was the comment?
Well, this is my regretio again. Do you guys come on the show after having enjoyed a few mojitos?
Not mojitos, just
You know how
Caffeine
crazy
and-
this show would be if we did that.
caffeine and dairy and
I come on the show
Caramel
literally after
then
finishing with patients, so that wouldn't work out well.
Well, that wasn't it. She comes on to say, that includes you, Mr. Ed.
No, hey,
yes.
you had to prepare for your knee injection.
It is the drink, but it's just caffeine and sugar. It's not alcohol.
Yep.
And then Rusty also said something there. What's he saying?
Are you gonna read it?
This is talk like a pirate day. What?
See what I did there?
Anyone want to?
Were we doing that before?
No, we weren't.
Oh, okay.
He was saying,
Sorry, Rusty.
anyone want to try?
What was our idea for something to try at BJ's? Jonathan and myself wearing short shorts and athletic socks with
Yeah,
something like that.
something really crazy, and seeing who broke character first.
Yeah, that's right.
Whoever broke
Keeping
character
a straight
first
face the whole
had
evening.
had to buy
Has to pay for
the
the
meal.
pizza. And the,
Yeah.
Okay,
That sounds
so
like a good plan. We'll have to.
We'll see if we do that. And if you see us at
it was BJ's.
BJ's,
yeah.
then try to get us to break character, and that would be good. So until next time,
I'm Dr. Wayne Vaughn.
Dr. Mark Vaughn and Mr. Ed
There he is.
telling
With a
all
good
of
name.
you to stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.